Welcome everyone. Happy Webinar Wednesday. I'm Sarah Kurtz. I'm the Programs Manager here at Can Do MS, and I will be your moderator this evening. I want to start with a big thank you to our sponsors for helping make these programs possible. We really appreciate that. So welcome to August. I can't believe we're here already. Our theme this month is staying healthy. We are kicking off the month with our webinar today, and then our next opportunity to plug in is going to be next week for our coaching program. And then we will take a little bit of a deeper dive with our Jumpstart programs, and then we will wrap up the month with another coaching program. If you've not been to a coaching program lately, the second coaching program of the month has been changed to Your Questions Answered. So it'll just be an open forum for you to come and ask questions of our speakers. And so you can register for any and all of these programs online, or you can give us a call and we can register you over the phone. So we hope to see you again later this month. All right, so some housekeeping. How to ask questions during the webinar. We'll save about 20 minutes for the end, at the end of the webinar for questions. So if you do have questions come up during the presentation, you can type those questions into the question chat box found on your control panel. And as always, this presentation is recorded and it will be archived on our Can Do MS website, so you can access that again later. And a copy of tonight's presentation will also be included in the additional resources. So our first fabulous speaker tonight is Rosalind Cal, PhD. Roz is a clinical psychologist who has specialized in MS care and support and education for over 40 years. And she's also a senior programs consultant here at Can Do, so we're very fond of Roz. Up next, we have Dr. John Schaefer. Dr. Schaefer is the founder and emeritus director of the Mercy Multiple Sclerosis Center and medical director of the MS Achievement Center in Carmichael, California. He's practiced with Mercy Medical Group in Sacramento prior to his retirement earlier this year in February. After 45 years in practice, he has been active in several national MS organizations and has been on the faculty of Can Do MS since 2004. So we got a lot of knowledge in this room tonight. And now I am going to kick it over to Roz to discuss tonight's learning objectives.
Thanks, Sarah, and it's really fun to be doing this with you tonight, John. Our learning objectives for tonight are to describe the key components of comprehensive MS care. What are all the disciplines, who are all the clinicians who can be involved in your care at different points along the way. We're going to talk about how emerging MS research relates to opportunities you have to improve your MS care while working with all of these different healthcare professionals. And we're going to talk about how you can review your ideas with your healthcare team. How do you advocate for yourself to make sure that your needs are being met? But before we get started, I think we have a polling question for all of you.
Indeed. So let's just start with the question of, how satisfied are you with your current MS care team? And by MS care team, that means, your neurologist, if you have one, or a primary care physician, or nurse practitioner, or your physical therapist, occupational therapist, the whole works. So select one of these responses. Are you very satisfied, mostly satisfied, somewhat not satisfied at all? So interesting, it shows here that about a third of people are very satisfied, 40% mostly satisfied, and somewhat satisfied 23%, and not satisfied 7%. So hopefully some of the things we're going to talk about today, which is what is comprehensive care, what is your care team, and how do you have some effect on putting it together, that maybe we can improve those statistics. Roz?
Yeah, I certainly hope, and that would be our goal, that we can help improve the experience for those of you who are less than satisfied. But I'm actually thrilled to see how many of you seem pretty satisfied with the care you're getting. So let's talk some more about what's involved and give you some tips about how to enhance your team if that's what you want to do.
So the point of this program this evening is to talk about what are the different elements of comprehensive care and what does comprehensive care mean and how can you improve your comprehensive care situation. I think to talk about this, it's always important to start with an understanding of what is MS and what is MS doing, how does it behave, how does it affect you and other people with MS, and that way we can best understand, are we succeeding? Are we administering the care in the right way? So this is a graph that you've all seen before. And the lines here, in the middle, you see the dark black line that has all of these little blocks on it. And those little blocks represent symptoms of multiple sclerosis. So in the very left-hand panel, which is labeled preclinical, there's no symptoms. So it's at a baseline. And then we're tooling along, and then suddenly there's a spike. And that spike is an attack of multiple sclerosis. It may be, for example, loss of vision. You wake up one day and vision is impaired in one eye, and it lasts for a few days. It may get worse, sometimes going on even a couple of weeks, and then usually it gets better. And as you can see, the line drops back down to baseline, meaning that there's recovery, which is a good thing. But the problem is when there has been an exacerbation of MS, there is a very substantial risk that there will be other exacerbations. And that's what we see as we follow that line along, that there's another block, which may be something different. You wake up one morning and there's numbness in your left leg, which over a few days works its way up your abdomen to your chest, maybe involves loss of walking, loss of bladder control, and then it gets better. But as you can see in this line, not necessarily to normal, hopefully to normal, but not always. And then after that, there are more attacks, more exacerbations, those little blocks. And then a very significant part of multiple sclerosis, and the part that is for a lot of us the most serious part, is that when people have gone through this relapsing remitting phase early on, that many people, we don't know exactly how many, but certainly at least a half, go into this progressive phase where things get worse. So things being walking difficulties, symptoms, bladder, bowel, coordination, speech, cognitive, all of these things get progressively worse, even without any attacks. You can see that there is one little block, so one attack there, but there may be no attacks at all, but a progressive worsening. Some of the other aspects of this slide are that the arrows that are pointing upward along the bottom are new spots which show up on the MRI brain scan. And you can see that even in the preclinical phase, there may be spots that show up on the MRI brain scan. Now, of course, we don't do MRI brain scans on people off the street just to see if they've got MS. But when people come in with a new symptom, we may look at their MRI scan and say, gee, there's been stuff going on there even before the symptoms which define the MS. And or people may have a MRI scan done for some completely unrelated reason, and lo and behold, there's some MS plaques. In the relapsing remitting phase of multiple sclerosis, there's lots of arrows, meaning there's a lot of attacks, a lot of new white spots that show up. And then in the secondary progressive phase, as we said before, there may be very few or even no attacks at all, even though progression is occurring. So even though walking is getting worse, still there's no new spots showing up on the brain scan. That dotted line near the bottom is sort of the total amount of the white spots on the brain scan. If you put all of the white spots together and add them up, their size, so you can see that there's kind of a gradual increase. Finally, the red line, everybody's brain shrinks with age. But we know that in multiple sclerosis, a lot of times this shrinkage may be more rapid and occur at earlier stages of life than in the general population. And that dotted red line is brain atrophy, or the volume of the brain. Next slide. So the important takeaways from this slide are that there's two different processes going on in multiple sclerosis. On the one hand, there's relapsing remitting multiple sclerosis, and most MS, about 80% of people with MS started out with relapsing remitting, and this occurs in early adults, and the symptoms, like I mentioned, attacks of loss of vision or attacks of difficulty walking, or things that come on and then may improve or even go away, but then continue to recur. And then there's the progressive part of MS. And that was what we saw in that final panel in the previous slide, where things are just getting worse over time, even without any attacks. So there's big differences here. Age, as I already mentioned, the relapsing remitting is the part that generally occurs in younger people with MS, and then the progressive parts, either primary progressive or secondary progressive in older people. Primary progressive, to define that, is that where I said in that previous slide that some people go through the relapses and remissions and then go into a progressive phase, some people start out with the progressive phase and have never had any attacks. This is more likely to occur in middle age as compared to the relapsing remitting, but like secondary progressive, things just get progressively worse year to year. Age is such an important thing. Whenever any doctor calls me up and says, Dr. Schaefer, I want to talk to you about one of my patients who has multiple sclerosis. First question I always ask is, how old is this person? Because if the person is 29 years old, the answer is going to be different than if they're 50 years old or if they're 70 years old. Why is this? It's probably because the immune system behaves differently in people of different ages. People in young adult years have immune system that behaves in one way, but people who are in their 50s, 60s, 70s, their immune system reacts differently to stresses around it. And then just to mention, there's new terminology, and I don't want to complicate this too much, that talks about whether these processes are active, meaning with exacerbations, or progressive. We all know that we have people that we say have relapsing remitting MS because they've had an attack, they've recovered, another attack, and they partially recovered, and they're not having any more attacks, and they're not getting worse. So this is somebody that we would say is not active, not having exacerbations. And similarly, in the progressive phase, we have people who have had long-standing MS, who have impairment from it, and they're not having any attacks, and they're not necessarily getting worse. I'm afraid this is complicating things a little bit, but let's go to the next slide. So what we want to talk about today is what is MS comprehensive care? And there are aspects of it. So I'll mention that I know that there's a lot of questions that have been submitted, and they're excellent questions, and we'll, Roz and I will address those at the end. But So to start out with, what does comprehensive care include? In the left-hand column, identifying the disease in the first place, making that diagnosis of multiple sclerosis, and I can't stress this enough, what we know today with the medications that we have for multiple sclerosis, and there's more than 15 that are available, that if they're started early on, after the first symptoms have appeared to define the disease, we know that the risk of having those further attacks and the risk of going into the progressive phase are considerably less. And that's why it's so important to identify the MS and begin the treatment early on, because once the damage has occurred, we don't have medicines that are very good at getting rid of it. So for somebody that's been diagnosed and started on a treatment, how do you know the treatment is working? Well, importantly, that they're not having any new attacks. I mean, that's the main thing that we're interested in. But then also, we monitor with MRI scans, and you know, there's different intervals depending on the stage of disease and depending on your doctor to see are new spots showing up on the brain scan, because we know, and again, we saw that in the first slide, that there are a lot of arrows, new spots showing up, even when there aren't any new symptoms. But that's not good. If there's new spots showing up, it means that the control of the MS isn't where you want it to be. And then there's managing attacks, exacerbations. What do we do when someone actually has an exacerbation of MS? We use things like steroids. And then there's always the important role of rehabilitation through all of the phases. And then finally, alleviating symptoms. So people who have trouble with bladder control or pain or walking, there are medications that can help the symptoms, even though they're not changing the other aspects of the disease. Roz, what are we talking about the rehabilitation and support?
So I think any of you who have participated in any CAN-DO program with us know that our emphasis is on helping people function optimally, safely, independently in their lives. And that is a key part of comprehensive MS care that should go along with all of the things that John's describing in terms of actually managing the disease process and the relapses. So they're key members of the team who help people in their everyday life to function and feel better. So physical therapists who focus on primarily mobility and balance and use of mobility aids so that people can stay independent. As one of our colleagues says, the answer to disability is mobility, and that's where physical therapists come in. Occupational therapy helps people manage their everyday activities and control their fatigue and use tools to simplify activities and work and at home so that they can function optimally. And speech language therapy helps people with speech and swallowing, but interestingly, they're also very involved in helping people with MS who have cognitive difficulties. They evaluate cognition, but also provide compensatory strategies to help people function at home and at work. There's also an important emotional support component, which of course, for me as a psychologist, is one of my key areas of interest here, where we want to help people feel emotionally the best that they can, because we now know that mood changes like anxiety, depression, irritability are components or symptoms of the disease of MS, as well as reactions to the challenges of life with MS. So evaluation and intervention by mental health professionals, as well as support from family and friends and from each other, are key components of comprehensive care. And this is the package that that John and I are so passionate about and have worked our entire careers to make happen for people with MS and their families. So if we can go to the next slide, you can.
Can I make one comment before, although the next slide is going to demonstrate this? I think what you can see is in the left-hand column, we're talking about things that your medical professional would do, your neurologist, nurse practitioner, MS nurses, and in the right-hand column are things that other team members. Living with multiple sclerosis is complicated. It affects life in so many different ways that's why it takes all of these different components.
Thanks, John. So if we go to the next slide, you can actually see this. The most important aspect of this slide to me is that you and your support network, you and your family are at the center of this team, which means that a lot of what we want to help you do is build this team around you and also know how to comfortably advocate with your team for the things that you need the most and that are your priorities. The blue circle is this core healthcare team. So all the things that John was talking about in terms of managing the disease, managing your relapses, making sure you're kind of on track, those are going to be done by your neurologist or perhaps your primary care physician. Some of you may see a nurse practitioner or a physician assistant. But however you do this, you have a medical team that's handling those medical aspects of MS care that John described in the left part of the screen. At different points in time, you may have interactions with your extended healthcare team. So at different points in time, you might need or be referred for physical therapy for something that's going on, perhaps a relapse, or just your mobility is not as strong or confident or quick as it used to be. Or you may be referred to a dietitian because you have concerns about healthy eating or weight loss or how to feel your very best with MS. So all of the people around the outside can be members of your team at different points in time. And ideally, when you have an MS comprehensive care team, not only are these individuals working with you, but they're communicating with each other. And one of the advantages of being seen in a comprehensive MS center that's all in a unified campus or a unified health system is that all of these professionals have access to your medical records. So they are working together even while they're working with you to manage your care. John, is there anything that you want to add to that?
No, and I would echo that the importance of, neurologists can open up the electronic medical record and see the physical therapist report or the pharmacist report or the psychologist report. They're all in the same place, and understand that medical records are not shared across the board. So I often have patients show up in my office and the first time I've seen them or the first time they've been seen in my system, and I ask a question, they say, well, doc, that's in my medical record. Well, your medical record may be in Southern California or something like that, and I don't necessarily have access to that. So, sticking with doctors who are working in the same group may have that advantage.
There are a couple members of this extended healthcare team I just want to call out to you because it may not be intuitive that they're part of the team. But one is the pharmacist, right? Now, many people with MS take a lot of medications, and they may get medicines from a specialty pharmacy. They may also get medications from their regular pharmacy, but it is the pharmacist who is often the most helpful person to answer questions like, how are my medications interacting with each other? Or do I need to be concerned about that? Or about a side effect of a medication? So I would urge you to use your pharmacist because they can be extremely helpful. In addition to that, I think it's important to call out the role of the primary care physician. So some people are seeing a primary care physician for all of their care, but most people with MS do see a neurologist. But it's important to know, and I was taught this by the neurologists I worked with over the years, they do not do your primary care. They are not focused on your heart health or any other of your primary care or preventive care issues. They're focused on your MS. So for those of you who've been relying on your neurologist or nurse practitioner for all of your care, I would encourage you also to see your primary care physician every year and make sure that you and your support partner keep up with your preventive health care, because the primary care physician is really important to your overall care. I think we have another polling question at this point.
So that brings up the question of where do you receive most of your MS care? There are MS comprehensive care centers around the country where there are multiple specialists and radiologists and rehab teams all in the same group, or a lot of times that's not available, and it may be an MS specialist provider, which could be a neurologist or a general neurologist, that is a neurologist who doesn't necessarily specialize in MS, and then primary care physician or other. So indicate in this form, you know, where do you get most of your MS care? So I have blocked off, unfortunately, the part. Oh, okay, I see. I changed some of the boxes around so it covered up the answers. So MS Comprehensive Care Center, about 20% of people, and I think that that's quite realistic because there are a limited number. MS specialists, 45%, and then general neurologists, and general neurologists are certainly capable of handling this, almost 30%, about 5% from the primary care physician, and then others. Did we, Sarah, did we see the results in the chat box for that?
I'm looking, not that I have seen.
Okay.
You know, one of the things that's important to know, I worked at an MS Comprehensive Care Center for many years, and many of the people who came to the center came for, let's say, a yearly consult. They were seeing a local care provider, whether it was an MS specialist or a general neurologist or a primary care physician, but they would come to the specialty center once a year to just check in, just see if there was anything that was new that their own doctor might not have known about, or to ask about some of the newer medications. And then they would go back with the information from the specialty center and take it back to their provider in their hometown. And I think it's important to know that that's a strategy that you can use. The MS Comprehensive Care Centers welcome you to come. They're not trying to steal you from your home doctor. They're just there. They'll give you some suggestions or thoughts. They'll send a letter back to your own provider, and it's just a good way to access specialty care if you don't have it near to you.
Mm-hmm.
Can we go to the next slide? So for those of you who are wondering about how to access comprehensive care, I think there are definitely challenges depending on where you live in the country. You may not be near one of the MS comprehensive centers that John referenced. Mostly they tend to be near big cities. So if you're in a rural area, they're harder to come by. And some people actually travel a few hours to get to their MS care. So it's not easy for everybody. One of the things that's happened lately is the telehealth has become much more available. John, would you comment on telehealth for MS care?
So telehealth has been enormously helpful, and it's enabled us to expand care to many people. I imagine a lot of you have seen your physicians, your neurologists or other physicians by Zoom or FaceTime or even by telephone, and that's really changed things enormously. I live in Sacramento, and Northern California is this huge geographical area where people, may be, hours away from us, but now with Zoom, we can see them as if they're sitting right in the room and they haven't traveled at all. I recently did a follow-up evaluation on one of my patients who was in Mexico at the time of the visit. So we're hoping, these changes were made to accommodate the COVID restrictions to travel and to being with people, but there is great hope that these will be continued. And I might throw in a punch here that the National Multiple Sclerosis Society is lobbying Congress to pass laws which will extend the telehealth option. So contact your MS office and your legislators and tell them how important this is to you.
So before we talk about the self-advocacy part, I just have a question for you, John, because I know people have asked me this. A lot of what happens when a person with MS goes to the neurologist is a neurologic exam, which involves some hands-on testing of spasticity and various functions that you do by touch. So when you do a telehealth session with somebody, let's say a follow-up with that patient, how are you evaluating when you can't do hands-on connection?
Great question. So in the first place, in my practice, we've always encouraged the first visit to be a live in-person visit, both because they take longer to get all the background information and to do a very thorough exam, just as you say, whether somebody can feel the prick of a pinpoint or watching them walk is much easier to do when they're in person. Many of the return visits are people who are pretty stable, that they're not a return visit because something new has shown up, but because we're monitoring whether the medicines are effective or not. And so one needn't, even in a face-to-face setting, repeat the whole exam. It is surprising how much can be done, though, even on Zoom, like coordination. How fast can you tap your fingers? Touching your doctor nose to finger. Well, you don't have to have the finger, but just touching your nose. And how fast can you tap your feet? Even we can watch. And then speech. I can assess how somebody's speech is, and so it is surprising how much you can tell.
So I think one of the other challenges to getting really, really good care is how much you as a person with MS or you as a support partner who go to the medical visit, how much you share of your questions, your needs, and your priorities. People say all the time now, the visits are too short, the time gets taken up with conversations about disease-modifying therapies or an MRI, and what the patient is sitting there thinking about is, I'm worried I'm going to have a bladder accident, or I'm in so much pain I can't even think, or I'm not sleeping at all, which is not helping my fatigue. If you keep those things to yourself, the doctor doesn't know, or your nurse practitioner doesn't know. So in addition to the priorities the neurology provider has, you have priorities as well. And then you need to think before your appointment, what are my key questions? What are the things I need to make sure we talk about or schedule another appointment to talk about because they're important to my quality of life? It's also okay for you to request a referral. You saw that big circle of providers that are available, and you may say, can you please refer me to a dietitian who can help me figure out my eating habits? Can you refer me to a physical therapist because I really want to get a baseline on my mobility, or a mental health provider? Because now we recommend that everybody gets evaluated for depression every 6 months, right? At the time of diagnosis, and then every 6 months, we want people's moods evaluated. So you can ask for that. And you can also ask your providers to share your records and communicate with one another if you're not in one of those systems where the medical record's available. You may actually have to carry the records and the notes from one provider to another, but you can do that and become part of the communication system with your team. So go ahead, John.
I want to underscore that, outlining your questions. When you have an appointment with your doc, okay, you get a reminder that said your appointment is, Wednesday afternoon at 3 o'clock. There's a reason for that. I mean, it's not just, you're not going just because the robocall told you that you're supposed to go. There's a reason. There's things that you want to know or you want to tell the doctor. So write those down. And I think it's a good idea, even when you walk into the doctor's office and sit down, or even if it's a nurse or a nurse practitioner who ushers you in, say, here's the questions that I want to ask today. I find myself, embarrassing that I'll, get in a conversation with the person and I'm asking the questions that I think are important, and we come to the end of it and they say, by the way, doc, the reason I made this appointment today is because of such and such, and, we're out of time. That's always a horrible feeling. So ask your questions early on.
Okay, we have another slide here, and this popped up a minute ago, but we really want to show you this resource at the National MS Society. So the link is at the bottom of the screen, but you can go to this resource, click on a drop-down menu of the type of healthcare provider you're looking for, what kind of support you're looking for, the zip code where you live, and how far you're willing to travel, right? So that way, what will pop up on the screen is a list of providers that you can access, neurologists, physical therapists, mental health providers. And there's a distinction. There are some people who come up on the screen who are partners in MS care. These are healthcare providers who have demonstrated to the National MS Society that they have knowledge and expertise in treating people with MS. There is a screening process that these folks go through, and the society makes the determination if they are partners in care. And then there are care centers that are designated as centers for comprehensive care, like the one that John had in Sacramento, the one that I worked on in New York, where this is a team that addresses the needs of those living with MS by coordinating a multidisciplinary care team, okay? So use this resource. It works, and it will help you access the care that you're looking for. And with that, I think we're ready for questions. Also, I want to remind you about MS Path to Care. We have resources on the Can Do website that talk about how to access care and what the different professionals do. So if this all went by too fast, you can use the MS Path to Care information on the Can Do website to learn about all these disciplines and how they can enhance your care.
Mm-hmm. Sarah, are you going to float the questions by us?
I am. So we have a lot of chatter going on in our questions box. I know that we got a few questions in advance of this webinar regarding, what's going on new in research. Stem cell therapy came up quite a bit. If you have anything that you can comment about that.
Let me just make a couple of brief comments. As far as research and what's new, we have a multitude of medications now that are very effective in treating relapsing, remitting multiple sclerosis. And as I said at the beginning, beginning those medicines early on and monitoring them to make sure that they're doing what you want them to do is really the key to importance. Progressive MS, we're a long, long way behind in finding medications. There have been a couple of medications that in clinical trials seem to have some benefit in primary progressive MS or secondary progressive MS, but those benefits are, very pale compared to the benefits of the medicines in relapsing remitting. And they may be helpful for some people, but not others. We're looking for new medicines for progressive MS. Things, research about, how to rebuild broken nerves. Multiple sclerosis is an attack on the insulating material on the nerve, the myelin. And when the myelin is damaged, eventually the nerve fiber drops out and dies away. And so wouldn't it be great to have something that puts the myelin back on the nerve or that prevents that loss of the myelin? And, there is research going on right now. I would have to say that it's not something where, I would tell somebody that you need to, run out and get this done right now or even enroll in a clinical trial, because we've got a long way to go. Stem cells. Stem cells is enormously interesting. There's a great deal of a misunderstanding about what stem cells do and what they don't do, and what are the risks of stem cell treatment. Again, what I would say is the clinical trials have shown that in certain circumstances, stem cells are effective. They work for MS. But interestingly, those patients are the same patients that respond to the medications. And the trials that are going to be coming up are trials that will compare. Well, let's take 100 people and 50 of them will give the newest and the best of the drugs that we have, and the other 50 will give stem cells, and we'll see, is there any difference in the benefits or the adverse effects? Those are things that are yet to come.
So I have two things that I'd just like to add to that, John. One is that you mentioned that there are many, many MS drugs out there now. And I think one of the benefits of that is that if you and your care provider are not satisfied that the medication you're on is controlling your MS adequately, if you're still having an attack or two, if you're still getting new lesions, you and your doctor may say, you know what, this isn't controlling it enough. And the good news is now there are other medications that work differently in the body that you can try. So for many MS specialists, what they're working towards is no disease activity of any kind. They really want you stable, and they will keep trying different medications until they help you do that and stay stable. So that's something you can bring up with your provider. Is my MS truly stable now, or do we need to think about doing something a little more? The second thing that I wanted to add just about the stem cells, you may get news articles or advertisements or messages that all you need to do is go to this overseas clinic and pay a lot of money, and they will do stem cells and it will cure whatever ails you. And we continue to urge people to resist that the data are still coming in on what stem cells can and can't do, but promises of curing everything tend to be untrue and dangerous. So be sure to check with your provider before you venture out to try any of those things that you see advertised.
I'd like to make one other point in assessing the effectiveness of medications. And I would say, you know, the original medicines for MS are things that came out in the 1990s. And those were injectable that people give themselves. We have a lot of patients who are still on those and have done very, very well. And they work well for some people. But there were people for whom those medicines didn't do as well, that they still had attacks or new spots on their MRI scan. And that's where the newer medications, as you say, Roz, now offers the opportunity to, you know, bring that effectiveness to more people. What we're looking at when we treat somebody with an MS drug is, are they having attacks? Does it keep you from having attacks? And does it keep the person from progressing? And those are all kind of difficult questions to answer. You know, what confusing attacks for, gee, I feel worse this week than I did last week, but everybody with MS knows that there are fluctuations in symptoms and how you feel. But, you know, truly a new attack, a new spot on the MRI scan, and then are things worse? The question I always ask people at every visit is, how are you compared to a year ago? How about your walking? How about your coordination? How about your memory or cognition? How are you compared to a year ago? The reason I bring this up is people will say, gee, I've been on a medication, the doctor started me on this medicine and I've taken it for 6 months and I'm no better than I was when I started it. It's not working for me. That doesn't mean that it's not working for you. We don't have a medicine that's going to undo the damage that's been done necessarily. And the purpose of all of these medicines is to keep you from having new problems and going into that progressive phase. Roz, you're nodding your head there.
Yeah, I think it's all true.
And so we have a bunch of other questions coming in. To pivot a little bit.
Sure.
Nancy had a really great question. She said that she has so many health concerns. How does she know which one to address first?
She has, say it again, so many health concerns?
She has many health concerns, so she's wondering how to know where she should start with building her comprehensive care team.
That's a tough question. And I think one of the things that Roz and I always emphasize in our programs is that, you know, MS is not the only thing that can affect a person. That, you know, a 50-year-old with MS, that high blood pressure and diabetes and high cholesterol and things, you know, unrelated to the MS, but are an important part of life. I tell people that, you know, very, very few people die from their multiple sclerosis. They die from whatever you're going to die from, which is heart attacks and strokes and cancer. And so addressing all of those things, it can be a tough juggling act, but that's why, again, it requires a good team, doesn't it? You know, your primary care physician and your neurologist who can communicate with each other and figure out who's, you know, who can help the most.
Thanks, John. And there's another question from Barbara. She wants to know if insurers will cover another visit if she doesn't have a clinical problem. So, for example, if someone wanted to go and get a second opinion, if they're not having an exacerbation or, you know, a flare-up, would their insurance pay for that?
I think that's a really, really tough question. And I think the whole insurance reimbursement thing is got so many bumps in it and things that, you know, in most systems, if you request a referral, a second opinion, that they should accommodate that. And as far as how often, I mean, if you're doing okay, do you need to see your doctor at all? Well, you do. Of course you do. Somebody with MS, you know, even if you're having no symptoms at all and you feel perfectly fine, but you're on a medication or you know, you need to see the doctor to make sure that things are stable. And insurance companies will generally permit that. The insurance company isn't going to say, no, you can't see your doctor because you're not having any new symptoms right now. They know that it needs to be monitored.
Thanks for that. So I'm going to punt this one to Roz. We had a few questions about other specialties. Where would they fall into a comprehensive care team? So specialties like a massage therapist or acupuncture, chiropractor, those kind of things. Are those part of a comprehensive care team, in your opinion?
I think each person's team is going to be somewhat different, right? So there's certainly some data to suggest that acupuncture can help with certain kinds of problems that people have. And if you talk it over with your neurologist, your primary care physician, and there's an agreement that acupuncture is a good way to go, then that acupuncturist becomes part of your team. It's not necessarily part of everybody's comprehensive care team. There are lots of different opinions about the role of chiropractic. And John, correct me if I'm wrong, but what I was taught by the neurologist I work with was that chiropractic can be very helpful for some orthopedic issues that people have, back issues or different kinds of problems like that, but it's not effective in treating MS in any way, and one has to be careful that what's done in chiropractic doesn't somehow interfere with spinal cord functions. But John, what do you think about that?
Yeah, I think that's, you know, what I've always said is there's chiropractors and there's chiropractors, and their view of, you know, how chiropractic treatments affect MS may differ from one to another, and so it's a hard question to answer. It's, you know, finding a person that that you're happy with and that you think is helping your symptoms is the main issue. I might also say that there's other, you know, in the team, there are other medical specialties like ophthalmologists. You know, in our MS center, we have ophthalmologists because lots of people with MS have visual problems. Urologists, lots of people with MS have bladder problems. Gastroenterologists, and so other medical specialists too are an important part of the team.
So we have a couple of questions regarding what is a reasonable expectation from a neurologist when you are over 70 and have different considerations for your MS than maybe a younger person would?
Great question. And another thing that I was going to mention earlier when we're talking about what's the latest research that's going on, it includes things like how long are these medications helpful for? You know, people start on the MS drugs when they're in their 20s and 30s and their 40s, and, you know, should they still be taking them when they're in their 60s and 70s? And the answer is, we don't know for sure, but there are trials that are going on right now that take groups of people and stop their medications to see what happens. So I think, you know, that's sort of dodging the actual question, but I think, you know, discussing with your neurologist and your neurologist should recognize that, you know, somebody in their 60s and 70s is different than before. Depends on also how long you've had the MS and what the MRI scans are showing. So,
you know,
tough question, but
as you alluded to before, John, all of us as we age have other health conditions that affect us. And we know that at the time of diagnosis, many people with MS have more other health conditions or comorbid health conditions, as they're called, than the general population. And the reason that's important is that people sometimes tend to focus so much attention on their MS that they neglect these other things like high cholesterol or diabetes or high blood pressure, but we know from some really good research that's been done by epidemiologists that those comorbid health conditions actually have an impact on people's MS. MS progresses faster for people who have a lot of these other health conditions, and it affects their lifespan when they're living with these other health conditions. So particularly as we age, I think it's important not just to focus on your MS, but to make sure that your primary care physician is taking care of those other things into your 60s, 70s, and 80s, because that's going to do more to extend your life than anything that the neurologist is going to do for the MS. Is that a fair statement, John?
Absolutely. Yep.
So we've got a few questions, a lot of questions about age and when or if you should discontinue disease-modifying therapies. Other questions about, you know, they're of a certain age and their neurologist retired. How important is it for them to get a new MS neurologist?
Good questions. As far as discontinuing the medication, as I say, it's a tough thing that you need to talk over with your doctor. One thing I would say for sure is probably don't make the decision to stop a medicine on your own. There's a couple of medicines, Tisabri and Gilenya specifically, that may have a rebound. I mean, if you stop them suddenly, things can actually fall apart. That's not true with most other medicines, but you don't know for sure. And so it's always a good idea to, you know, be in a supervised situation when you stop, if you're going to stop the medication.
That being said, I think we have heard from people, John, who've called the National MS Society or talked to people at Can Do and said, well, my doctor says I'm 60 now, so there's no need for me to take disease-modifying therapy. And we kind of know that that's not the case, that there's nothing magic about an age number that makes you not need your MS drug anymore. So what the doctor really needs to be looking at is the things that John talked about in the very first slide. Is there any evidence of new lesions? Has there been disease activity in terms of relapses, or is disability progressing? Because if any of that is happening, the disease is still doing something.
Right.
And you don't want to stop it just because you've hit a magic age of 60 or 65.
Right. I think it may be that there is some point at which the medicines don't have any function anymore, but I don't know what that age is. And it may be very different for you and the next person, and that's the issue that some of these studies are looking at now. There's not a magic number. You're right.
Thank you for that. There were a lot of questions about age tonight, so I appreciate you taking the time to answer those.
I wonder if that's a reflection on who the speakers are.
Not at all. So as a reminder, we will have a survey. We will ask you to complete a survey that'll pop up at your screen at the conclusion of this webinar. But first, I wanted to give Roz and John an opportunity to close us out with any key takeaways or anything that really stood out to you today.
Roz, why don't you go ahead?
I'm thrilled at the kinds of questions that were coming in. They're very, very thoughtful. And I think knowing what to do as we age and how to take care of our whole selves, our wellness, not just our MS, is critically important. And I would urge you to think about who's on your team and to build the best team that you can so that you can advocate for yourself and your quality of life.
Mm-hmm.
Great.
And I think the takeaways are, and I've said this already several times during this thing, is, you know, particularly for younger people or for people who are having exacerbations, it's really important to be on a medication. And I think the point of what we've made today is to be in a care circuit where there's somebody that's monitoring, are these medicines along with you, are these medicines working or are they not? And those care facilities, comprehensive care centers may be out there, or if you're not in an area where you have them, building your own, finding the individual physicians and the rehab people. You can do this through the MS Society support groups. It's a great way to do it.
Mm-hmm. So big shout out to our awesome speakers tonight. We really appreciate you sharing your time and talent with us. Now this webinar may be over, but we hope you'll stay connected. You can follow us on social media for updates on our latest programs, resources, and MS news. You can also register for our monthly e-news series by visiting candoms.org. So our webinar next month will be all about planning for an unpredictable future, which is something I think we could all benefit from these days. So thank you so much for joining us tonight, and we really hope to see you again at another Can Do program really soon. Have a great night, everybody.
Bye.
Hi, everybody. Thank you.
Thanks for coming.